Hi, I'm Lorelei Day with the City of San Angelo. Today we're here with Dr. Doug Schultz, Chief Medical Officer of Shannon Clinic. Hi Doug, thanks for being here with us today.
Hi.
So let's start off by talking about the Delta variant. That's what we're hearing about mainly with COVID-19. Can you tell us what it is and if it's here?
Yes, the Delta variant of COVID is, COVID is like a lot of viruses. It mutates into different forms over time, and they've named them Alpha, Beta, and then now this particular one is called Delta. And the reason it's important is it's got some properties that make it much different than the original virus. So the main two things are it's the spikes on the outside of it, like these little spikes right here, are much stickier, and so it's much more contagious when it gets into a person. It's much easier for it to get into you and infect your cells. And then the second thing it does is it's over 1,000 times more viruses in you once you do get infected. So all that combines to make it very contagious, much more contagious than the original.
So what are the symptoms? Are they different whenever somebody does contract COVID with the Delta strain?
The overall symptoms are not too different. The initial symptoms are a little more like a cold, runny nose, sinus type symptoms than the original one, but in the end it still affects your lungs and respiratory tract the same way.
Does the Delta variant affect children different than other variants did?
Yes, it does look like this Delta variant is a little, not a little, but quite a bit more contagious for young kids. They're not getting real sick with it, but there's a certain percentage of them that will have what's called long COVID, which lasts a lot longer and may debilitate them in ways like, decreased energy and things like that. So it's definitely concerning. Now, of course, there's no vaccine below the age of 12 right now, but that's another reason it would be great if the parents were vaccinated. That would, make it lower risk for their kids to get infected.
Okay. How's testing going right now?
Yeah, testing has increased rapidly over the last couple of weeks. There's more patients who are sick, and they're coming in wanting to be tested. And our urgent cares are all set up to test people, but there's so many compared to the last few months that we went ahead and opened up our drive-through testing center, which is at the Urgent Care West. And that opens today, July 29th. And it's open 7 to 7, 7 days a week.
When we last spoke to you, it was about 7 months ago. Vaccines had just been approved and they were being administered to the first priority group. Can you talk about where we're at now in our community, how we're doing with vaccines as a whole?
Yes, on the vaccines, we started out fantastic, and everybody wanted to get the vaccine, especially those that are high risk, so over 65. Those with chronic conditions really came in, and we saw large numbers of people getting a vaccine every day, 800, 900, 1,000 a day. And once we got through that population, it started to taper off. And then COVID itself started to taper off, and so we saw a big decrease in the number of people wanting to get vaccines. And we started to get into the categories where people just either didn't trust the vaccine or felt like they were leery about the side effects, and so we saw a real fall off on the numbers. Actually, before this Delta strain came, we were probably getting 60 to 70 people a day getting vaccinated.
Can you talk about how effective vaccines have been against COVID-19 up until this point?
Well, the original, the first wave, the Moderna and Pfizer vaccines were like 95% effective. With this Delta strain, they're slightly less effective, but maybe 85%. But they're still like 95% effective against serious illness. So they're still very protective against the Delta variant as far as getting put in the hospital or are dying.
So with St. Angelo sitting around 40% vaccinated right now, how does this impact the spread of COVID-19 in our community?
Yeah, the fact that the people over 65 are more like 80% vaccinated, so that's great because they're a very high risk population. The younger crowd, overall numbers at 40%, and that's below the national average and below the Texas average actually. So we do need to increase that. What that does is it produces two groups of people. The group of people that are vaccinated, so the spread of the virus is really slowed down. And then you have the other group where goes like wildfire through them, and that's what we see right now. We see a huge number of positive tests and people getting sick from this Delta variant because they're not vaccinated. So it's producing two groups of people and allowing the virus to spread rapidly.
Let's talk for a minute about the children under 12. When do you anticipate they'll be able to be vaccinated?
The studies are ongoing right now on the children below 12. I think the results are still pending. I think we expect probably by the end of this year or early next year that the age will be lowered. I don't know exactly what that age will be lowered to, probably 5 or 6 years of age.
Why do you think people are hesitant to get the vaccine?
People are hesitant for actually a large number of reasons, but there's been a lot of studies on that, and two of the main reasons are they don't trust the vaccine and how it was made, or they're worried about the side effects. There's some other camps that don't believe it, period, but those are two of the biggest ones, and I think we're starting to learn that we need to talk to people and get them to understand that the benefit to them. And I feel like one of the problems I see is, as a medical professional, is there's so much information out there right now about the vaccines and about COVID, and you see all the media, right? TV, social media, etc. There's so much overwhelming information. It's hard for the average person, it's a lay person, to what's true and what's not true. And so I would like people to think about, if they have a relationship with a physician that they trust, I would highly recommend that they talk to a physician, because the physicians are trained to study this information. That's what we've done our whole life. That's what we know how to do that. That's part of being a physician. We can sift through the data and read the studies and understand the risk-benefit ratio for a person. And that's what we do every day, not just with COVID, but if somebody may need surgery, that we go through that with them. What's the risk of the surgery? What's the benefit to having the surgery? And in general, people trust their physician's judgment on what the best thing for you is. So I think this is the same way. If people would kind of cut through all this noise and reach out to the physicians that they have a trusting relationship with, whether that be a specialist or a primary care physician, and go, hey, what do you think about this vaccine? And then I think they'll find that they'll get a good answer that's tailored to their particular needs, and that would be my advice at this point.
So something that's out there right now is that the vaccines might cause infertility. Is that something that you would suggest people need to talk to their doctor about specifically, or is that just a flat out lie, or what do you have to say to that?
It's not a lie, but it is not true. The American College of OB-GYN, it's called ACOG. That's a very respected group that advises the obstetrics and gynecologic physicians, on what they should do. And they have come out very strongly with a statement that there's no evidence for infertility problems with these vaccines. But there's good evidence that it's very dangerous to get COVID during your pregnancy. And so, again, the risk-benefit is in favor of getting the vaccine. in a childbearing age.
If people have previously tested positive for COVID, do they still need to get a vaccine?
Yes, if you've tested positive for COVID or you've actually had the disease of COVID and been ill, it is still recommended you get the vaccine for the simple reason that we do have these mutations and your antibodies could wane from the original infection and you would be susceptible to these variants. So yeah, definitely need to get a vaccine after you get over your illness.
Okay. We've heard the term breakthrough infection, or breakthrough infection. Can you explain what that is?
Yes, what happens there is, this Delta variant is able to infect people who have been vaccinated, but at a much lower rate. There's still a very tiny number of them getting infected, and when they do, they're not very sick, very mild illness, very few ending up in the hospital, and so that's called a breakthrough infection. But again, that's not unusual with vaccines, where you have with other illnesses either, where you have a milder version of that, like a flu, for example. If you had a flu shot, you might still get the flu, but it would be a lot milder. So that's what a breakthrough, and that's completely normal for any vaccine.
Okay. What precautions should people be taking right now?
Of course, the CDC is coming out with changing guidelines almost daily, seems like, because this is happening so rapidly. And so, their latest recommendations is to go ahead and wear a mask, even if you're vaccinated, and certainly if you're not vaccinated, when you're in close proximity to other people in a smaller space. To me, that just makes common sense that you do that. Again, in my world, we've worn masks, our whole career. We wear masks in surgery and when we're in rooms with people that have infectious diseases. So we're kind of used to wearing a mask. So it's not that big a thing for me. It doesn't bother me. But I understand people that are not used to wearing a mask. They don't feel comfortable with it, but I think if they think about it just logically, it makes sense to put a mask on. It's not that hard, and it probably could protect you quite a bit.
So for people who have not yet been vaccinated, they might see this having to mask up again as a disincentive. What do you have to say to that?
It's true that originally they were saying if you were vaccinated, you didn't need to wear a mask, and so that was great. That was a good incentive to go ahead and get the vaccine. Now they're saying go ahead and wear one anyway, because you could get this breakthrough infection, which again, you won't probably get that sick, but you do have to be quarantined for 10 days. So you might miss work or not be close around your family. So that's an incentive to go ahead and wear it.
Well, Dr. Schultz, again, thank you so much for being here with us today.
You're welcome.
For more information, visit cosatx.us/COVID-19.